Okay, so I think we'll just go ahead and begin. Hello, everyone. If you don't know me, I'm Geraldine Antonio. So I'm the Tribal Liaison with New Mexico Alliance of Health Councils, and so happy to see each and every one of you here this afternoon, spending your lunchtime with us. And so for this month's Health Council talk, we'll have two presenters, Wendy Wintermute. So she is with the Alliance and she's our grants manager, along with many other hats that she wears. And then we also have Christine Hollis with the Department of Health, Region Health Equity Specialist. And then we'll just also receive a quick update from Leah Sanchez from NMPHA. So if Leah is on the call, Leah, are you on the call right now?
Leah is just coming in now.
Oh, perfect. Okay. So what I will do is I will stop share. And Leah, I was just explaining that we're gonna, I know you have to skip out early today, so we'll go ahead and have you start off with just a quick update from the NMPHA conference. And then, are you good to go?
Yeah, thank you so much, Geraldine. Thank you, Wendy and Chris and Sharon for having me, and happy Friday, everyone. My name's Leah Sanchez. My pronouns are she, her, and I'm Executive Director of the Mexico Public Health Association. We just announced that our new co-executive director has joined us this week. Her name's Tessa Abeta, and she's a city councilor from Las Cruces. We're really excited her on board, and you guys will meet her in other spaces, I know. But I wanted to share that we are in full planning mode for our annual NMPHA conference. This year it's going to be May 19th. Really want to do as part of this conference is give folks working in public health and related fields an opportunity to share your important work with a brand. And so the way we do that is we invite you to submit proposals for sessions you'd like to at our conference, be it a presentation about your work, maybe a panel discussion, maybe a longer workshop of 90 minutes. Maybe you want to submit a poster, sort of that you see sometimes in scientific conferences. And then also we have a new type of session this year that we're calling thriving sessions. They're going to be this long. And we would love for folks to share their work and how you all care for yourselves, because we know our public health workforce has been really the past few years, and those thriving sessions will be a chance for us to learn about strategies caring for ourselves and our community, and then also some time to actually practice that activity. So maybe a session about the benefits of walking, and then part of the session is, you know, we all go on Zoom on our phones and take a walk together. So we're really thrilled to hear about your work. And I just wanted to share my screen real quick so you could see where to go on our website for more information. Here we go. So this is nmpa.org. This news, we have the heading submit a proposal. We are looking forward to hearing proposals in Spanish this year as well as English. We'll have two-way interpretation at the conference, and so we invite folks to share their work in Spanish as well. And then I want to go to our annual conference page. Here you can find a little more information about the days and times, learn about the call for session proposals. There are information sheets in English and Spanish about the proposal submissions. We have slides from a presentation, a workshop about how to submit a proposal. We have a work, because proposal form is in Google Forms, and so we created a worksheet for you all to use. It's a little create in a Word document and then use it later to submit in Google Forms. We actually have a proposal workshop today at 4 p.m. that you can register for or join if you like. There's Zoom information on our homepage. And then on Tuesday, we will have a proposal workshop in Spanish as well at 4 p.m. So we'd love for you to register for those. This is really an opportunity for you all to share your work and, you know, be in community with other public health folks and sort of celebrate all that we know and do and learn from one another. Can I answer any questions right now? I know I've gone a little bit over my time.
I have a question, Leah. Sorry that I'm off camera. This is Susie with the Alliance. Is that open to agencies that are maybe not specifically in public health, but do work with the community?
Definitely. Yes. We want to, this conference is public health as a big tent. Our theme is building communities that thrive. And we love to hear from these working, on related issues, if not, core central need issues. So yes, please, we'd love to hear from you.
Thank you.
And Leah, just to clarify, so you have a abstract workshop today at 4 p.m.?
Yes, today at 4 p.m. Zoom information is on our homepage. And then we'll have another one in Spanish next Tuesday at 4 p.m. And I'll just drop my email in the chat in case anyone wants to follow up with specific questions. Our website should have a lot of information too. And thank you so much for time on your agenda. I know there's a lot to cover today, so gracias.
Perfect. Thank you, Leah, so much for joining us. And in our follow-up email for the Health Council's talk, we'll be sure to share the NMPHA website link and then more information about the annual conference. And then also the abstract templates that you were also referring to earlier. So we're going to go into our two presenters now. We'll start with Wendy Wintermute. So she is going to talk about Share New Mexico, which is a resource directory. And then she'll kind of just share a little bit of information about the range of resources available and how to share what matters to you. So Wendy. Oh, you're on mute, Wendy. Oh, still on mute.
Unlike yesterday when I was not on mute. Okay, let's try that again. I'm going to share again. Get to the share resource directory. Oh, come on. See all these little windows here. All right. Sorry. So sharenm.org. That's the easiest way to find us. Just type that into your URL. You can also search for us, but that's kind of the fastest way to find us. So it should be coming up. All right, this is one. There we are. Okay, let me move some things around so we can see. So this is our homepage, sharenm.org. And we have a number of different kinds of resources here available for you. This is open and accessible to anybody who wants to avail themselves of the information we offer on this page. Back up just a little bit, I want to give you a brief history because so many of you were instrumental in creating this website. When we started about 10 years ago, we thought the state agencies would be really interested in this, and it turns out they weren't quite ready for it. So we went to the community. Thank goodness we did. We went to the health councils, we went to navigators, we went to community health workers, and we said to them, what information do you need to do your job? Because we like to provide it to you. And so they did. And we have now evolved over the past 10, 12 years. In September, we moved back to our roots, which are now located here at the Alliance. So we're really happy to be back with the Alliance and back with all the health councils, because you really were where we started and now we're back. So our mission is the same. We really want to provide you all with the information you need to do the job you're mandated to do, which is to keep us all healthy. Healthy people, healthy communities. So again, this is our website for 3 components now of information. We have directories all over our site. And we do have space here to highlight things that are happening in New Mexico. So if you want us to highlight something you're doing on our homepage, just let us know. How do you let us know? Let us stop right there and show you our ever important contact us button. If you have any questions, any suggestions, anything to contribute to the site, just click on that. You'll get this little pop-up window and it will come to us, to our team. Now, as I said, anybody can access this information, but to contribute information, which we hope you will do, you do have to be registered. It's easy to register. You click on here. If you're not already registered, click on here. You'll be asked for your name, an email address, and a password. And then once you've registered, you can log in and access all of our functionality and also contribute information. So our most popular destination is our resource directory. That's what you were really instrumental in helping us develop, because everywhere we went, the first thing everybody said was, we need to know what resources are out there. And what we discovered is that everybody is trying to create their own lists and keep them up to date. And it's a really hard thing to do, if not impossible. So what we'd like to invite you all to do first and foremost is to take a look at our resource directory here, because this is ours. It's shared by all of us. As I said, you were instrumental in creating and maintaining these resources. And thank you very much. So we want to be sure that you know how to use them to your best advantage. So this is a resource directory. I do want to stop and introduce one of our interns. Liz, are you there? Liz?
Yes, I'm here.
Okay, Liz is there. MSW intern for this semester before she moves on. She's really our resource directory manager at this point. So if you click on that contact us button, you have any questions about information in the resource directory, how to use the resource directory, you see something that's not quite up to date on the resource directory, please let us know. Click on this contact us button and you will reach me, Liz, and our other intern, Nicole, who's also an MSW from NMSU. So it's pretty easy to use. You can search our resource directory by location, which would be county, city, zip code. Does anyone want to put in a county? Anyone want to search their county? Don't all speak at once, or speak all at once, whatever. You want to search a county?
Grant.
Grant. Is that Maryland? Okay, Grant County. What would we like to search for? We use the AIRS categorization system. This is from the Association of Information Referral Systems. This is the system that the 211s use, that our other partners, Center for Development and Disability at UNM use. A number of people use this. Because it's standardized, it makes it easier for us to share the information with other databases. So we are comprehensive in that we have resources that address all of these main categories, first level categories for AIRS. So Marilyn, is this you? Who from Grant County are we talking to?
It's me.
It's
How
you.
about checking the behavioral health and substance misuse
Okay.
category?
Okay, so that is down here. Behavioral health and substance abuse, unfortunately, a popular search parameter. Would you like to further that down, narrow that down a little bit more, Marilyn, by one of these subcategories?
Probably outpatient behavioral health.
Okay. And then we can also narrow it down even more by using a keyword. Some people, for example, are using for medically assisted treatment programs. So we could try it and see if what we get. This is also the search you'd use if you were looking for a specific organization. You just type their name in here and it should pop up. But let's see what we can get here. So we're going to click the search button. And we get the Santa Fe Recovery Center. I bet that's because we have the mat. So these are resources that meet all these criteria that are either located in or serve Grant County. This is not located in Grant County, but they do say they serve Grant County. Let's take that out and have a broader search and see what we get. A few more. resources that don't specifically offer medically assisted treatment, but they do offer outpatient behavioral health. Again, these are organizations that are located in Grant County or say they serve Grant County. If you see a resource on here and you say, I have never seen them here in my county, send us a message and we'll check it out and make sure that in fact they are serving your county, because we don't want them popping up on this list if they're not in fact accessible to you and serving you. Now, if you just want to know, just want to have a list of the resources that are located in your county, we're going to make this a little easier to use in our Share 3.0 iteration, which we're working on now. But for the moment, if you are registered and logged in, you can click this export search button, and it is going to export to an Excel file the organizations that meet your search criteria and that are actually located in Grant County. So this has basic information. You probably don't need this. Address, city, state, phone numbers. If you want to map it, you have the latitude and longitude and some additional information. So once you download this Excel file, it is yours to do with as you wish. And I'm going to show you, either me or Liz, one of us is going to show you what we did with these Excel files to make it easier for you to use in your county. So that is, that's the Excel file. Drop this. Another way that you can share this information with other people is to click on, you see something you're interested in, you can click on this little arrow, and it gives you a more detailed profile of this organization's services and what they can offer you. So if you want to share this with someone, you can someone's needs to mute. You can click on this little printer icon. It'll make a PDF for you, and you can attach this to an email or print it out, whatever suits your fancy. One of my favorite home visitors really has to have her printed notebook of resources. So what she does is she goes and she does a search of the resources she's interested in. She prints out the PDFs of those resources. She hole punches them and she sticks them in her folder. So that's her printed copy, but she knows that she can update those printed copies at any point in time. She just goes back into the resource directory, does another search, finds new information, prints it out, hole punches it, sticks it in her folder. But another way that you can, another thing you could do with the Excel file, Liz, I'm going to turn it over to you. Liz, you've done this for a couple of counties. Which county should we look at? You know what? I know we have Lincoln County represented. Let's go to Lincoln County. Here's something that we did. I'm pretty sure we have Lincoln County here. Hello. What we've done, one of our clients asked us to do a listing of basic needs and mental health resources located in Lincoln County, which we did. But then, as we always do, we wanted to make that information available to everyone. So Liz, tell us how you did this list.
Yeah, so just as Wendy pointed out, of course, I use the Excel spreadsheet that you can export from our website. And we went ahead and made this into kind of more printer friendly, easier shared information. So just the most important information, organization, the programs that they offer, where they're located, and then contact phone numbers, and then divvied that up by the different types of services that they provide. So you can see that we have it specialized out from the housing programs that are offered, emergency shelter programs that are offered, food pantries that are offered, just a way to make it a lot easier. And it seems a lot more printer friendly for people rather than the Excel spreadsheet that has a little bit more information on there. So making it much easier to share for people. And then of course, with our information on there so people can contact us if they have any questions.
Mhm. So we've been doing this with counties. Otero County, you're next up. I think you're here. Otero County, this is what we're going to do for you. We're going to provide a listing like this for you so that you can use it to update the information. Liz will be there to help you do that also. So that you can submit it. I think what you're going to use it for, Otero County, is for 100% community. Is that right? And Chavez County, similarly, I think we're sending you a list similar to this to use for your 211 directory.
I remember where the food thing is, this way or this.
So let us know if that's useful to you. If it is, it's one of the functions we can provide for you, one of these bits of information support that we can provide to you. So that's our resource directory. Any questions on how to use it or how to share the information? Oh, let me add this little button here. If you would like to, let me use ours. I'm going to look for our profile. Share New Mexico. I encourage all of you to check your organizations. Make sure the information is updated. If it's not, you click on this little pencil and it brings up the form you can use to update your information. Again, if you need any help doing this, hit that contact us button and we'll be really happy to assist you. If you have just a quick update, we just got one today. I'm the new executive director. We can make those quick updates for you. So let us know. We really depend on you to help us keep all this information updated for everyone. If you're not in our directory yet and you want to add yourself, click on Add a Program, brings up that same form, and you can add your information. And again, let us know if you need some help doing that. Any other questions on the resource directory, our most popular destination? Have all you tried it? Have some of you tried it? I hope many of you have tried it. Any feedback?
I have a question, Wendy.
Uh-huh.
This is Susie
Susie?
with the New Mexico Alliance of Health Councils. And I'm thinking as though if I were a health council that was either struggling, maybe to find someone to hire. So is there any kind of resource where maybe there's something in my area, maybe not in my county, but in my area where I could maybe find a pool of candidates that I could hire to, kind of help us out with the work, anything like that?
Well, there is if you want to steal people from other organizations, Susie, but I'm not sure that that's what you're referring to.
Like kind of like here in Doña Ana County, we have like the work. Well, I don't think it's just Doña Ana County, but we have like workforce solutions types agencies. That,
Oh,
that-
yeah. Oh, sure. Yeah, absolutely. So Doña Ana County, let's see what we get. Doña Ana County, you would look for the category employment, and let me write it in. Employment.
Can we use those like maybe would it be okay if we use a sample of maybe like a smaller? So either maybe Katrin or Colfax.
I doubt that Katrin and Colfax would have, oh, well, let's try it. They won't have anything in their county, but they
Right.
might have something close by.
Right.
Okay, so are we specifically looking at employment?
Yeah, it's just an example.
Okay, let's see what we get. Well, that's kind of far-fetched, but there might be others here that might work. Gallup might be close enough to Katrin County to take a look. So you might want to look through these and see if there is anything that looks like it might be useful to you. If you're specifically talking about veterans,
Mhm. Okay, thank you.
healthcare workforce. So I encourage you all to try it out and let us know what your experience is. Let us know if you found what you were looking for, because we do not use all 546 codes from the ARES category. When we developed the resource directory, we went to the community health workers and navigators and said, what services are you most likely to want to refer to? And from that feedback, we picked 50 of the 500 and however many categories we could use. So some of the searching that you'll do might require a little ingenuity, and we'd be happy to help you find the search parameters that really produce the results that you're working for. So let us know what your experiences have been, especially if you have any problems or questions or would like some assistance. We are happy to assist you on that.
Wendy, this is Evangeline from Grant County. So this may be a silly question, but most of the information or data or anything that's in there is inputted from the agency, or do you guys go in there and input periodically, or where does it mostly come from?
All of the above. It really is all of the above. To start with, we imported a ton of resource databases from different state agencies and community health councils. We do have our team of interns led by Liz, who are systematically going through and updating lists. And most recently, we've been reaching out to all of you who have lists, inviting you to share those with us so that together we can update those lists, import them into the share directory, and then we'll all be able to benefit from having what we think is the most up-to-date list possible. Now, it goes without saying that the minute these lists are updated, they're out of date because something is going to change. We have 14,000 listings in our resource directory, so you can imagine that something's changing as we speak. But we really want to work more closely with you to make sure that together we can keep this information updated. So it's all of the above. We get emails, more and more emails lately from people saying, I have some updated information for you, sharing resource directories again with all of you, the community health councils, having our team work on this. So all of the above. But primarily, it really does depend on you. I think we can say at this point in time, Sharon, stop me, cut me off if I'm too soon, but we are in conversations with 100% community because they also need to have a resource directory about how we can share our efforts.
Can you write this for me? This Wendy email, write that email out for me. I need to get in touch with that.
I will, but let me point out too, the contact us button here at the top will also get to us. But I will also put our email in the chat.
It's already there. I'm sorry. I'm driving. I'm talking to somebody to write out the email for me.
Okay.
It's already in the chat. Thank you.
Hi, Wendy. How are you?
Fine. How are you?
Doing good. So great to see you. So Elizabeth was kind enough to send the share, the link that we have for Be Well NM, and I see that some of the information is outdated. So do I reach out to you guys for bringing it to current locations and everything else, or?
Please do, Veronica. Thank you. And it's nice to see you again too, and to try to keep up with you. You do move around a bit. Veronica, incidentally, we all owe Veronica a big thanks. She was really instrumental in helping us achieve our census goals over this past census. Thank you, Veronica.
Oh,
now she's
it was an honor. It was a pleasure. Yes.
Right. So now she's tending to her health from Be Well New Mexico. But yes, so again, I encourage all of you to check your organizational information or organizations about which you have information. If you'd like us to send you a list like the one Liz just showed you, we'd be happy to send you one of those. Might make it easier for you to scan and see if anything looks out of date or problematic, or if we're missing something, let us know. That'd be great. But we are trying to work with other partners like 100% community so that we work together, sharing the work and then sharing the benefits. We do not want to own anything. We just want everybody to share everything, kind of like what you learned in kindergarten. So resource directory. Now, do I still have time? Oops, real quickly. That's not as I think our title is. We're not just a resource directory, even though that is our most popular destination. We do have a page for every county in New Mexico, and these pages are also for you to share information about what's going on in your county. So let's see, Doña Ana. I think we got some Doña Ana people here. Doña Ana, this is your county page, and this area here is for you to share information about what's going on in Doña Ana County, both for other residents of Doña Ana County, but we're also interested in learning what you're doing so that we can let people in other parts of New Mexico know what's working in your county. So here again, we put some of those listings that Liz showed you for the county. We've got a link to the Wellness Institute, which is the Health Council. We've got some information from the Anna Age 8 Institute, 100% community. They've just completed a survey, and if you want to see their results, they're right here. We also have a very interesting program called Fostering Family that's working in Doña Ana County, well, actually, southern part of the state, the central part of the state, and the northern part of the state, based out of Rio Arriba. This organization is helping relatives, grandparents and other relatives who suddenly find themselves taking care of children, helping them find resources that they need to fulfill that job. So if you have news, information, things that are working in your county, let us know. Contact us button at the top of the page. Let us know what information you'd like us to put in this space. We have an events calendar for every page. I know that Veronica and the other folks are very active in posting census events in the calendars. We can post them for any and all counties. So if you're doing something statewide, we will post that event on all of our counties as well as on our homepage. So feel free to add an event. If you're registered and logged in, you just click on this little button, a pop-up comes up, and you can add your information there. Okay, that's good. I gotta get rid of it here. I can't get rid of it. I'm going to go back to the Doña Ana County page.
Wendy, do you have data in regards to how many people access the calendar or the resources here on this website?
We do. We have Google Analytics available to us, which track hits to the various pages.
Is it possible that you can share some on just general basis with the group?
Not at this moment, but if you send me an email, I'll be happy to put together a report on that. We also have a library of reports, flyers, toolkits, videos, any information that you think will help you and your colleagues create healthier communities in your county and in our state. Let us know what you've got and we'll put it in our library. And also some quick links here. Now, our goal here is to, as we say down at the bottom, which is not showing up because this is there. Our keywords, which you cannot see, are reflect our mission, which is to connect information, ideas, and people to support positive change in New Mexico. So we allocate special space on our county websites for those initiatives that are working together, that have made connections and are working together to accomplish the goal of a healthier community. This is probably does not reflect all the collaborative initiatives happening in Doña Ana County. Let us know who we're missing, and we'll be happy to give them space and recognize the work they're doing together. This is a list of organizations that have recently been added to our resource directory or who have updated their information. So those are our county pages. We offer those to you to use here to spread the information about what you're doing. If you already have a website, and I'm not sure if the Health Council does. Does the Health Council have a website? No, they don't yet. So what we've done instead is we've downloaded a document that has your overview, Doña Ana County Wellness Institute. But if you'd like to have your own page, we can do that for you. We can create a page for you. Last but not least, we have a social initiative pages here, and these reflect what's happening in various areas of importance throughout the state. Community health, picture loading, community early childhood, food and hunger. I want to point out this one, law and justice, because a lot of you are really interested in what's happening with people coming out of incarceration, or you're trying to prevent people from going in to our into our jail prison system. So here's some information with some interesting new programs that we've just heard about that are helping people who are coming out of incarceration. Women in Leadership is a peer-led group. It's based in Albuquerque. Because of COVID, though, they've learned how to be, they operate everything on Zoom, so they do serve people statewide, and they conduct programs in the institutions that serve women. They've got something coming up in Springer, for example. This is Cadets is a collection of people that are trying to find jobs for those who are coming out of incarceration. Housing for returning citizens, always a challenge. The Housing Authority publishes a list of housing that's available to people with those kinds of records. So you might want to check out our initiative pages also to see if there's a program that might serve you. If you can't get in touch with them, if you have any questions about any of these, let us know. In our early childhood group, early childhood page, we also have a couple of interesting initiatives that I mentioned. One is the Fostering Families program that we talked about. And another, this is the Kinship Navigation program that supports relatives, grandparents, and other relatives who are supporting children. And another really interesting initiative, CARA, is the Comprehensive Addiction Recovery Act. It's federal and state legislation that requires that any baby who is born in New Mexico or to Mexico family who shows up as substance involved, their family must be offered a plan of care to assist them to make sure that that baby grows up healthy and well. So as I said, each family is offered a plan of care. They are not required to accept it. But if they do, the plan of care then is implemented by the insurance company, which covers the family, which in at least half the cases is one of our Medicaid providers. So CARA has a number of work groups. They have a page for families, a page for providers, and they have several work groups here that focus in on families that have a particular challenge. The mother is incarcerated or recently exiting from incarceration. How can we build housing? How can we find housing for relatives who suddenly find they need a 2 or 3 bedroom home instead of the 1 bedroom apartment they've been living in? Can we reach out to families when they're pregnant and perhaps using substances so that we can get them involved in this program earlier? And then Geraldine is part of this group, the tribal work group. How can we make connections with babies whose families are tribal affiliated? How can we refer services, transfer services to the tribal health and social services agencies and forge better connections with tribal entities? So that's what we have to offer. Research directory, county pages. Let us know if you want us to put you on your county page, and social initiatives for information that relate to what's happening statewide. That, in more than my allotted time.
Yes, we're getting close now. I have a quick question, Wendy. I think for those who are interested, if you're going to register, that is no cost, right?
No cost. Thank you. Yes, Geraldine, no cost. Your contribution to the SHARE website is the cost for you to participate. So please contribute what you know, share what you know, as we say, with the rest of New Mexico. We're better together.
Well, thank you so much, Wendy, for taking some time to share with us how to share through Share New Mexico. So I did put the website in chat as well as your email. So if anyone's interested in maybe a list or wanting to link your health council website to the county page or any other questions, Wendy and our interns would love to help you. So now we're going to transition into our last presenter. So our presenter is Christine Hollis. She's from the Department of Health, and she serves as part of the health promotion team from the Northwest region. She is a health equity specialist. So we're happy that she's able to join us today, and she's going to share a little bit about a template that she's created to help health councils if they're interested in increasing membership or diversity. And this could be in terms of maybe the health council or the health equity committee. So Christine, or Chris, as we know you, it's all yours now.
Hi, everyone. I'm so glad to see you. I'm not exactly sure how much more I can say than what Geraldine just said. She pretty much described it. Most of you, I think, are with health councils. So but the others probably also know. Health equity specialists are sort of new positions that the Department of Health has put together with the health promotion teams that Geraldine just described. So we're kind of regional. I'm in that Northwest region, but the metro area. So dealing with 4 different health councils, and then there are health equity specialists in all the other regions. And one of the reasons that our position was created was to, specifically help with this CDC Kellogg Health Equity and Community Rebuilding Group, or the project, as well as other pieces. And as you well know, part of this is that the view of the legislature, as well as DOH, as well as the New Mexico Alliance and everything, is that, the health councils are considered really the voice of the community. It's made up of volunteer members in the community. Some have staff and are lucky with that. But it is meant to be the voice of the community. And one of the things is that some of the health councils are smaller than others, but all of them that are involved in this particular program, of the ones that I work with, some have raised the question that, they do try to recruit members from the community to, sort of build their membership, and to hear, different groups of people and what their views are on things. And what I've seen in general is that a lot of the recruiting is sort of done as a kind of a flyer, part of their newsletter, something saying, so-and-so health council is recruiting to, for our board or for our membership or anything else. And, sometimes it gets a good response, but sometimes not so much. And of the health councils I was working with, and especially since the emphasis is on health equity, kind of asked me, is there any other way that we might be able to motivate, people to come onto the health council more so than we've been able to do? And so I decided I would just take a crack at maybe trying to develop a template that health councils might use if they had, looked at their membership, noticed some gaps, noticed, some voices from the community that they wanted to hear more from or have participate. And so, Geraldine, can I share the screen or?
Yes, I could share for you right now. And let me know if you would like this document or the other document.
Yeah, let me start with that one. I'm not sure we need to show all of them, but literally, I tried to do this with input from the health councils, at least that I was working with, because I know at least one of them, when I started drafting, for example, a letter, just a template that a health council could use to invite someone. Let's say you were looking around in your community and decided, we really need to hear from, a representative of, people with disabilities, or we want to have more youth involved, or, a lot of different pieces in there. And, the health council member came back to me and he said, I see the benefits in the sense of the health council as a whole. He said, but what are the benefits for the person? Why would they want to be on the health council? So we tried to do a little bit more of that. And I'll show you just one example that we came up with first. But being that this is for the health councils that are participating in the Health Equity and Community Rebuilding Program, I wanted also just for there to be some direction for people to think about the health equity piece first. And so this, Geraldine, if you could just scroll down that, I don't know if you can or not. But essentially, this was taken from a sort of racial equity assessment piece. So literally, really what I was just suggesting that a health council, before starting to invite groups, they might want to just sit down and say, are we missing anybody from the table? Is there, are there groups that we should definitely have here because we want to hear from them as we move forward with, a community health assessment, a community health improvement plan, any of the sort of mandates that health councils are supposed to do. So the first thing in putting this together, and by the way, what I did was after getting a lot of feedback and trying a couple of drafts, I basically have sent this out to the other health equity specialists so that if they felt like it, they could provide that to the health councils they work with. And this is totally, this is not mandated. This is just like a suggested template if anyone wanted to use it. I've pretty much provided it to people in Word format or on a PowerPoint, so it's very easy to change, adapt, use only pieces if that's what you want or anything. It was really meant to be something like a time-saving device. But this piece was, I just asked people to, try to read through this first. And Geraldine, if you would be so kind as to just show that other. So what I'm going to show you here is I tried to draft the template for people both in a letter format, like if you really wanted, if a group wanted to go the formal route and send one to a group, it's more a formal kind of letter, but there are places in there for you to sort of fill in the gaps, put in your logo, do things like that. Again, it's a Word document. The other thing I tried was, if people wanted to be much more brief, was there's a little card format in PowerPoint. It looks a little upside down when you look at it, but that's just because you'd need to fold the piece like that. And that was meant to be a little more informal. And then I took the card format, and this is something you might be able to use in an email format, just stick it in or whatever. So the way this kind of looks is I wanted a little hook or an attention getter at the top. So there's a little picture of people talking or chatting. And down below that's the statement is, it could have been like, I'm really impressed with Christine Hollis. Now that is someone who's really making a difference right here in Bernalillo County and across the state. And you could just fill it in. And I have to say, this came from an advertisement for one of the big journals. It came on an outside of a package for me. And it had this little sticker on there in exactly this kind of statement with a picture of two women talking in a cafe. And it just really caught my attention. And I actually opened the package. So I was kind of just using this as like an attention getter, and one can stick in any kind of picture that you might want, or something, even people in your health council chatting. Then Geraldine, if you can keep rolling down, thank you so much. You can personalize it by putting in your own health council logo. The Alliance and others kept telling me, keep it short, keep it simple. So the highlights basically give you an idea. This is to invite you, join us. And here's the only real motivation points we came in with was, make your voice count. Come to our group because that's what we do. But not only that, but because the Alliance is helping right now, help to, build the capacity of the health councils, we put in sort of our members, we're right now, this is a good time to join because we're getting training and support in kinds of skills that, may not only be useful to the health council, but for you as a member in your own work or professional life or anything else. And then, of course, going, this is just the teaser. So I'm here to talk to you. I can fill you in on more of what the health council is doing and why you'd be important and that type of things. And then just below, in a smaller box, again, very short, just something of the background of the health councils, why they're important, what they're doing. And again, to kind of stress that this community-based focus we're taking is significant because we are by and for the community. So I'm going to stop right there. As I mentioned, these are just, it's like if a health council has like a little resource bank and wants to stick a tool in it that they might or might not use, these are there in the letter format, the card format, and the email format if you wanted to use them and adapt them in any way you wanted. So I would just put that forth. Questions, suggestions, comments?
And thank you, Chris, for sharing. I know that at some point we had mentioned we could also tailor for tribal health councils, especially with imaging, and that we're definitely going to do some follow-up with that. But are there any questions or comments at this time?
No question. I just wanted to say thank you, Chris, for this, for these cards. I think they're going to be great.
Chris, you may want to put your email in the chat.
Okay.
Okay, and we got a little comment in the chat saying she loves the letter. So I definitely think this could serve as a great resource for health councils and county, tribal, both. So if you are definitely interested in wanting to increase membership and diversity and looking for kind of a template or resource to do that engagement, maybe in any of the formats that Chris had mentioned. And Chris put her chat or her email here in the chat. So definitely follow up with Chris if you have questions or would like any of the information that she shared or would like to download some of those resources.
And Geraldine, I just want to point out that Marilyn asked if there is a list of health equity specialists, and there is in fact a list of the whole team, all the team members for each of the health promotion teams on the Alliance website. So I posted a couple of links in chat.
Yeah,
Yes.
please feel free to reach out to the health equity specialist as well as your health promotion specialist. Can't believe I got all those words out.
Yeah, so if you haven't already, yeah, we highly encourage to reach out to your health promotion teams, which do include promotion specialists and health equity specialists, as Chris mentioned. So, but thank you so much, Chris, and we will be sure to share this in our follow-up email and any of the resources that you have to offer, in addition to the suggestions and the templates that you got. So if there are no further questions or comments, are we good to go ahead and close out now? Okay, all right. So thank you so much to all of our presenters today. I'm gonna do a small, a quick share screen here, just to end out the our health councils talk today. So we had some wonderful presenters, and so thank you to Leah Sanchez and Wendy Wintermute and Christine Hollis. So just some quick updates before we leave for the day. Our CDC trainings that happen on the 1st and 3rd month, just a reminder that we did cancel for next Monday, the 21st, to observe President's Day. And then following next Friday, we are having a refresher training that's provided by Susie Johnson. And so the topics for that training and the refresher is for reporting and invoicing for new health councils coming on, or even just health councils in general if they're interested and want to join. But what's different about the 25th is we are going to have Joan from NMCDC. So she's going to talk about the data dashboards that we had once discussed in our training. So she'll be there to answer questions and give another overview. And she's also offered her support to do trainings at health council meetings. So if you're interested in that, please reach out and we can get you in contact with Joan. So some health councils have already requested that, but she'll be able to kind of do a little brief overview on the 25th. So she'll be there for questions as well. And then following the 25th on the March 7th, we're going to have another CDC training, and that will go over the health council capacity assessment results and looking at capacity development support. So on that note, I would just like to say thank you to all of our health councils and on the coordinators for helping share and disseminate those capacity self-assessment surveys, because we had a really awesome turnout. And we look forward to sharing that with you on March 7th. And also our next health council talk will be on March 18th. So our topic is going to be the New Mexico School-Based Health Centers. And we'll have presenters from Department of Health, Jim Farmer and Nancy Rodriguez. So if there are no other updates right now, Sharon or Susie, are we good to end here?
We are. Great job, Geraldine, and thanks everybody. So happy to see you today. Bye-bye.
Thank you. Happy Friday.